Should you worry about a high PVR test? Imagine sitting on the toilet and still feeling like your bladder isn't completely empty. That's what a high post-void residual volume test can reveal. It measures how much urine remains in your bladder after you urinate. Normally, less than 100 milliliters of urine should be left behind. If it's more than that, especially over 200 milliliters, it might be a sign your bladder isn't emptying properly. When the residual volume exceeds 300 or 400 milliliters, it's often considered abnormal and could point to urinary retention, which needs medical attention. A high PVR can happen for many reasons. It might be due to a blockage in the bladder outlet, like an enlarged prostate or a narrowing of the urethra. It could also be caused by weak bladder muscles that can't squeeze enough to empty the bladder fully. Neurological conditions such as multiple sclerosis or spinal cord injuries can interfere with nerve signals that tell your bladder when to contract. Sometimes, previous surgeries or pelvic organ prolapse can also affect bladder emptying. If left untreated, high residual urine can lead to urinary tract infections, bladder wall damage, or even kidney problems. From a bladder health perspective, persistent high PVR is something to take seriously. While it isn't a direct sign of bladder cancer, ongoing urinary retention can cause changes in the bladder and increase the risk of infections. It can also make it harder for doctors to detect or diagnose bladder issues, including cancer, if urine isn't being fully expelled regularly. That's why if your healthcare provider finds a high PVR, they will want to investigate further. They might ask about your symptoms, perform a physical exam, and order additional tests like ultrasound or urodynamic studies. Treatment depends on what's causing the retention. It might involve medications to relax or shrink the prostate or to improve bladder muscle strength. In some cases, catheterization may be necessary to help drain the bladder. Surgery could be considered if there's an obstruction. The goal is to improve bladder emptying, prevent infections, and protect your overall urinary health. So, should you worry about a high PVR test? It's not something to ignore. It's a sign that your bladder isn't functioning as it should, and it warrants further evaluation. Early diagnosis and treatment can help prevent complications and keep your bladder healthy. Remember, everyone's situation is different, so always consult your healthcare provider for personalized advice and care. They can help determine the cause and guide you toward the best treatment options for your specific needs.